Have you ever wondered who operates behind the scenes in healthcare facilities? In the vast and complex world of healthcare, there are many unseen heroes who ensure the smooth running of every operation, every procedure, every diagnosis. Among these unsung champions are engineers. Yes, engineers. They may not be the first profession that comes to mind when you think of healthcare, but they play an integral role in the delivery of medical services. One of the most critical aspects of any healthcare facility is its medical equipment. From the smallest syringe to the most complex MRI machine, each piece of equipment is vital in delivering effective healthcare. Imagine walking into a healthcare facility without any equipment. It's simply unfathomable. In the casualty department, the emergency rooms, the diagnostic centers, the pharmacies, the labs, medical equipment is everywhere. But these pieces of equipment don't operate themselves. They require a specific set of skills and knowledge to run efficiently and safely. That's where the engineers come in. They are the ones who ensure that every piece of medical equipment is functioning as it should. They are the ones who troubleshoot when something goes wrong. They are the ones who maintain, repair, and optimize these critical tools. Consider the value of these investments in medical equipment. They represent a significant chunk of any health facility's budget, and their proper functioning is crucial in delivering quality healthcare. Without engineers, these investments could be at risk. So let's take a moment to appreciate the role of engineers in healthcare, particularly biomedical engineers. They are essential in strategic management, in planning, in ensuring that the healthcare facility can deliver the services that patients need. Without them, can a facility function properly? The answer, quite simply, is no. Biomedical engineers, and all engineers working in healthcare, are crucial pieces of the puzzle, ensuring that everything works together as it should for the benefit of all patients. Behind every piece of equipment in a healthcare facility, there's an engineer making sure it works as it should. They are the unseen heroes of healthcare, working tirelessly behind the scenes, making a difference in every patient's life. Can you think of a healthcare facility that doesn't rely on medical equipment? A seemingly simple question, but with profound implications. From the moment you step into a healthcare facility, right at the reception area, the role of medical equipment becomes evident. It's in everything from the thermometer to the MRI machine, the stethoscope to the surgical instruments in the operating room. Now imagine a world without this equipment. It would be like trying to paint a picture without a brush or create music without an instrument. It's simply unimaginable. Every single piece of medical equipment, no matter how small or large, plays a critical role in the delivery of healthcare services. But it's not just about the equipment's physical presence. It's about the financial investment that goes into procuring and maintaining this equipment. It's a significant part of a healthcare facility's budget, often ranking third after human resources and infrastructure. Why such a hefty investment, you may ask? Well, the answer lies in the impact of these tools on healthcare delivery. Think about it. Medical equipment aids in accurate diagnosis, effective treatment, and continuous monitoring of patients' health. It's the backbone that holds the healthcare industry upright. Take a diagnostic center, for instance. It's brimming with different types of equipment. The same is true for the pharmacy, the lab, the emergency room, and the operating theatre. Each piece of equipment is an integral part of the healthcare delivery process. But medical equipment is not a one-time investment. It requires regular maintenance, timely upgrades, and sometimes replacement. And guess who's in charge of all this? Our unsung heroes, the biomedical engineers. They ensure that the equipment is in top shape, ready to serve the patients and aid the medical staff in their crucial work. And so, as we delve deeper into the world of healthcare, it becomes evident that medical equipment is not just a tool. It's a lifeline, a critical component in the delivery of healthcare services. Without it, the healthcare industry would come to a standstill. Just how crucial is the role of a biomedical engineer in healthcare? Now that's a question that can spark a long conversation, but let's start with the basics. Biomedical engineers are the unseen heroes who make sure everything runs smoothly in a healthcare facility. From the reception desk to the operating room, every piece of medical equipment you see is under their supervision. Consider this. You walk into a hospital and see a plethora of medical devices. Needles, MRI machines, stethoscopes, thermometers, and even the complex theatre equipment all fall under the purview of biomedical engineers. These pieces of equipment are the lifeblood of any healthcare facility, and without them, the doctors, nurses, and other health service providers would be unable to deliver their services effectively. Now, imagine a scenario where a biomedical engineer is not included in the strategic planning process of a healthcare facility. It's like trying to sail a ship without a compass. The facility may not function properly and may struggle to deliver the necessary services to patients. The investments made in biomedical equipment are substantial. Diagnostic centres, labs and operating theatres are all filled with equipment that needs to be maintained, upgraded and sometimes replaced. And who better to guide these decisions than a biomedical engineer? They are not just the caretakers of these devices, but also the ones who can advise on the latest technologies and innovations in medical equipment. But the role of biomedical engineers is not limited to just maintaining and managing the equipment. They also play a crucial role in planning for new facilities. They help decide what machines will be required, what kind of service history needs to be kept, what consumables need to be ordered, and what type of maintenance program needs to be followed. In short, biomedical engineers are essential in ensuring the smooth operation of a healthcare facility. They are the ones who make sure that the equipment is ready and functioning when it's needed most. So the next time you visit a healthcare facility, remember the vital role that biomedical engineers play behind the scenes. In the grand scheme of things, they are the ones ensuring that the healthcare system stays on track. Biomedical engineers are essential in ensuring the smooth operation of a healthcare facility. How is modern technology changing the healthcare landscape? That's a question on many minds today. As we delve into the fourth scene of our narrative, we find ourselves in an era where technology is not just an accessory, but a necessity in healthcare. The advent of robotics in healthcare is nothing short of revolutionary. From robotic surgery that offers unparalleled precision to robotic prosthetics that restore mobility, this field is witnessing an exponential growth. These robotic systems, designed and maintained by skilled engineers, are transforming the way we approach treatments and surgeries. They're not replacing human skills, but rather enhancing them, enabling doctors to perform complex procedures with greater accuracy and minimal invasiveness. But that's not all. We also witness the emergence of fifth generation, or 5G technology. With its high-speed, low-latency characteristics, 5G holds the potential to redefine healthcare delivery. Imagine a world where remote surgeries are commonplace, where doctors miles away can operate on patients in real time, or consider real-time monitoring of patients' health statistics, enabling instantaneous response to any fluctuations. These are not distant dreams, but imminent realities, all thanks to the ingenuity of engineers working tirelessly behind the scenes. Moreover, the incorporation of artificial intelligence and machine learning is creating a paradigm shift in healthcare. These technologies are aiding in disease prediction, diagnosis, and even drug discovery, thereby reducing the burden on healthcare professionals and improving patient outcomes. All these advancements are not just enhancing the quality of healthcare, but also making it more accessible. Telemedicine, for instance, is breaking geographical barriers, bringing quality healthcare to remote corners of the world. This is technology democratizing healthcare, and engineers are leading this movement. However, the role of engineers in this technological revolution isn't limited to developing these technologies. They are also responsible for ensuring the safety, reliability, and efficacy of these advancements, making them an indispensable part of the healthcare ecosystem. The future of healthcare is technology-driven, and engineers are at the forefront of this evolution. With each passing day, their role is becoming more pivotal, more impactful. And as we move forward, one thing is certain: the intersection of engineering and healthcare will continue to be a hotbed of innovation, shaping the future of medicine. What does a day in the life of a biomedical engineer look like? Imagine stepping into a world buzzing with the hum of advanced technology, where the line between life and death often hangs on the smooth operation of complex machinery. This is the world of a biomedical engineer, where every day is an intricate dance of science, engineering, and healthcare. As the sun rises and a new day begins, Our biomedical engineer steps into a healthcare facility ready to face the challenges that await. With a cup of coffee in one hand and an equipment checklist in another, they start their rounds, inspecting and maintaining a vast array of medical equipment. From the simple thermometer to the complex MRI machine, each piece of equipment is a critical cog in the healthcare delivery machine. Their day is a whirlwind of activity filled with routine checks, preventive maintenance and troubleshooting. They may be called upon to analyze a malfunctioning ultrasound machine, consult on the installation of new lab equipment, or even design custom devices to meet unique patient needs. But being a biomedical engineer isn't just about the machines. It's about the people who rely on them. It's about ensuring that doctors have the tools they need to diagnose and treat their patients. It's about making sure that when a nurse reaches for a piece of equipment, it's ready and working. In a field where new technologies emerge at a relentless pace, our biomedical engineer also spends a good chunk of their day staying abreast of the latest advancements. Whether it's researching how 5G technology can enhance medical device connectivity or exploring the implications of robotics in surgery, they're always on the lookout for ways to improve patient care. As the sun sets and the day draws to a close, our biomedical engineer can look back on a day well spent. They've kept the wheels of healthcare turning, often behind the scenes and out of the spotlight. But they know, and we should too, that their work is vital. From the moment they walk into a healthcare facility, biomedical engineers are hard at work, ensuring the health and safety of patients.
The mission of Velocity Project Management Limited is to be knowledge partners by providing project management consulting services along with training services. Our vision is to be the leading institution for project management and management consulting services in East and Central Africa within healthcare. 1. Business planning. In planning, we start from the conception/idea of opening a health facility for our client by advising to do the right sizing of the facility, placement of the facility, and business guidance is provided too. 2. Infrastructure development involves engineering services, procurement management, tender management, project management, guidance on negotiation. 3. Equipment design and supply. Medical and non-medical equipment and maintenance are equally important to run a hospital, which needs planning from the beginning of conception. Proper contract management with all suppliers for spares and training of all HR involved. 4. Operations, management, training. Running of the hospital and handholding is taken care of by providing the right HR, business process mapping, HIMS, standard operating procedures, and defining various policies.